All right, so I'm just gonna do a quick scan of the room. Okay, these are my my IFC tower unit that I'm going to be using for my treatment, with all of my options on there for each treatment. And then I've got all of my materials here. I got my electrode pads, my bell and my timer, and my tape measure to measure my patient. Their edema for patient 2. Okay, so I'm going to go ahead and begin my treatment. I'm going to sanitize. All right. Good morning, Mr. Carl. How you doing?
Good.
My name's Cassie. I'm a student physical therapist assistant, and I'm going to be working with you today. So I understand that you are 4 weeks post-op from your ACL reconstruction on the left knee. And I know that you have some swelling in that knee and a little bit of pain. Is that right?
Mm-hmm.
Okay. So what I want to do today is something called IFC. It's a modality that we're going to use. It stands for interferential current. And this is going to help with our pain in the knee. And how it does that is we're going to put 4 pads around that knee, kind of surround the area where it's painful. And the current's going to go through it. And what it's going to do is send a noxious stimuli. And it's going to send a signal right up to your CNS and that midbrain and thalamus. And that is going to release opiopeptins. And those bind to specific receptor sites in the CNS and the midbrain and the thalamus. And the result is that we get release of endorphins in the brain. So kind of that feeling of like a runner's high, just that good long-lasting feeling. So more long-term pain relief is our goal for this treatment today. And I also want to work on getting some of that fluid moved away from the area. So with this treatment, we're going to have a little bit of flicker of the muscle, not a super strong contraction, but a little bit of a contraction. And we're also going to elevate it too. So it's going to kind of drain that fluid away from the area as much as we can, okay? So for this treatment, I'm just going to be placing the pads around the knee, like I said, and I'm just going to be I'm going to do a measurement before we start, so I'll have to expose the knee area, the left knee. Is that something that you're comfortable with?
That's fine.
Okay, great. Okay, let's go ahead and get started. I'll make you nice and comfortable, so go ahead and lay your head that way. I know you have your knee brace on, so you're in extension, so go ahead and swing it around. Okay, and I'm just going to prop up the limb here. Right, we want to make sure this is above the heart, so we have good fluid. That looks pretty good. And I'm going to go ahead and take your brace off, just get it out of our way. Okay, I know you're lacking about 5 degrees of extension, so are you comfortable in that position?
Mm-hmm.
Okay, wonderful. All right. So let's go ahead and get started. I know, like I said, I want to do that measurement first before we start. I'm going to measure the knee. Okay. And you're at about 35 centimeters, so a little bit puffier than that other knee. So like I said, we're going to try and get that down a little bit. And then on a scale from 0 to 10, 10 being like the worst pain ever, 0 being no pain at all, how would you rate your pain right now?
I'd say about a 7.
7 out of 10? Okay. Well, like I said, hopefully this treatment helps with that pain, and I'll ask you again at the end, okay? Okay. As far as contraindications go, no pregnancy to worry about, obviously. You don't have a pacemaker, correct?
I don't have a pacemaker.
You don't? Okay, perfect. So we don't have to worry about those things. Precautions, I just want to make sure there's no skin irritation or skin wounds in the area, but I'm going to check your skin before we start just to make sure everything's clear. And then good sensation as well. I know the PT did your sensation testing last time, so we're good to go there. We know we have good sensation in that area. Okay. So are you ready to go ahead and get started?
Yes.
Okay. So I'm just going to go ahead and double check that knee. Looks like there's no adverse effects, no wounds or irritation. So I'm just going to wipe it with a washcloth just to get it nice and clean, a good connection with our pads. Okay. So I'm going to grab our electrodes and I'm going to place them all around this kneecap here, this patella. So I'm going to go about 1 inch superior and about 1 inch lateral. And put it right there. I want to avoid any bones, any bony bumps, because that's not going to be very comfortable for you. Same thing, I'm going to go inferior about maybe 1 inch or 2. We'll go 1 inch, and then probably about 1 inch medial, just to make sure we're not on anything bony. Okay. I'm gonna do the same thing with the other 2 pads, but just on the opposite side. Okay. Just trying to avoid those bones. Okay. So I'm just gonna go ahead and show my electrode placement. So I got my channel 1 is my orange, and they are across from each other, and channel 2 is here, the blue. So you can see that they both cross each other and really focus in on that knee. Okay, so everything looks all set to go. I'm gonna go grab our unit, and we're gonna set our parameters up. So I'm gonna turn our sweep on. That just avoids, getting adapted to the field. So just kind of move the numbers around a little bit. So I'm gonna set our burst low at 1 hertz, and then I'm gonna set our burst high at 10 hertz. And then I'm gonna put our vector scan on at 100%. So that's just gonna kind of move a bigger space all the way around the area. So it'll kind of feel like a wavy feeling, okay? Are you feeling okay?
Mm-hmm.
Okay. And then the carrier frequency, we're gonna put at 2500 hertz. And the constant voltage, we're gonna turn that one on. And our treatment time is gonna be 30 minutes, okay? Because I really wanna get that fluid out of the area. Amplitude, I wanna turn up just a little bit till you feel a tingle. You feel the tingle?
Mm-hmm.
Okay, I'm gonna turn up a little bit more just till I see a little muscle flicker. Okay, I see that. And just a little bit more because I want that noxious, a little bit uncomfortable feeling. But that's what's gonna get those endorphins to release in the brain. So don't worry, just hang tight with me. So it's at 50 milliamps right now. I'm gonna leave it right there for now. We'll see how we feel. Go ahead and press start. I'm going to put this bell and timer right by you just so you can see what the time is, and if you need me, you can go ahead and ring the bell. I'm gonna come check on you in 5 minutes, okay? Okay, it's been 5 minutes. Are you doing okay?
I'm doing fine.
All right, great. Okay, 30 minutes is up, so I'm gonna just move this out of our way. All right, I'm just gonna go ahead and turn our machine. I'm gonna turn everything off to 0 so the machine is totally off. And then I can remove our pads from the area. I'm just gonna remove these. Okay, let's go ahead and check the skin. Everything looks good, no adverse effects, so we did well on that. I'm gonna go ahead and retake our measurement. Good, we went down 5 centimeters, so we reduced that edema slightly. And again, on a scale of 0 to 10, how would you rate your pain right now?
I'd say it's feeling better. It's about a 5.
A 5, okay, so we helped with the pain and a little bit of the edema, so I'd say our treatment is pretty effective. So I'm gonna go ahead and put your brace back on. Okay, put the brace back on. And I'm just gonna go ahead and kind of scoot you over, so go ahead and keep it straight, your extension. Go ahead and sit up for me. Great. Perfect. All right. And how did you feel? How you feeling?
I'm feeling good.
Okay. Do you have any questions about anything that we did today or anything about the treatment?
Mm-mm.
Okay. Well, if you have any questions, let me know. And it was really nice to work with you, and I look forward to working with you in the future.
Me too.
Thanks.